All right. Hello, everyone. Welcome to our March 2026 State TA Day webinar. It's great to see everybody here. We have lots of great announcements today. Hope everyone is enjoying the warm spring weather. We are going to kick it off today with Kathleen and Kendall. We're going to talk about apprenticeships.
Great. Hi, everybody. I'm going to get my screen situated here. Okay. And can everybody see my slides? Yes. Okay. Thank you. Always want to do a technology check. We never know if it's going to cooperate today or not. Well, thank you so much for having us. And we're really excited to share some updates with you in ECE apprenticeships. My name is Kathleen Sparrow, and I'm the Early Childhood Workforce Scholarship Specialist at CDEC. And I'm here today with Megan Moore, our Early Childhood Recruitment and Retention Administrator, as well as Kendall Einhorn, our ECE Liaison at CDLE. And we realize it's been some time since we've talked with you about apprenticeships, so we wanted to join you today and share some of the exciting things that are going on in the world of ECE apprenticeship. And we have a lot to cover in a very limited amount of time, so we're going to ask that you put any questions you have in the chat, and Megan and Kendall will kind of keep an eye on questions and answer them throughout. And then if we have a couple of minutes afterwards, we'll take some other questions as well. Okay. So first, we'd just like to share a quick overview of what registered apprenticeship programs, or what we call RAPs for short, actually are. So RAPs are a time-tested workforce training model that blends formal instruction with on-the-job learning. And there are required components that every RAP must include. First is paid employment. Apprentices earn wages from day one because they are actual paid employees. Next is on-the-job learning, or OJL. This is structured supervised work experience, and ECE apprentices complete a minimum of 2,000 hours of paid supervised OJL, gaining skills through real classroom practice. Next is related instruction, or RI, and this is aligned coursework or training. This can be college coursework or other types of professional development, or a combination of both. ECE apprentices complete a minimum of 144 hours of related instruction per year. And this instruction is aligned with the on-the-job learning as well as competencies. Next is mentorship. So apprentices receive experienced guidance and coaching from mentors, who work one-on-one with them throughout the length of the apprenticeship. And then progressive wage increases means that pay grows as skills and competencies grows. And then finally is a nationally recognized credential that apprentices receive upon completion of their apprenticeship. And this is a credential that is portable and often stackable within and beyond Colorado. So in Colorado, RAPs are registered through Apprenticeship Colorado, which is an office in the Colorado Department of Labor and Employment. And the U.S. Department of Labor gives authorization to our state to be able to register apprenticeships. And although becoming a registered apprenticeship is a lengthy and intensive process, it ensures quality, consistency, and alignment with both state and federal standards. And these required components are what really distinguish registered apprenticeships from things like informal training programs or internships in Colorado. Apprenticeships provide a clear, supported pathway to nationally recognized credentials, which help to recruit and retain and therefore strengthen our ECE workforce. So we'll talk a little bit more about why registered apprenticeships really work for ECE in Colorado, and there are actually several reasons. Apprenticeships address shortages because they can work in any community, whether that's urban, rural, or mountain areas, and in almost any type of program, including center-based and family home child care programs. Apprenticeships provide ECE employers with a structured way to recruit and retain staff. And this helps to build a pipeline of highly qualified teachers, which of course helps more parents to enter and stay in the workforce. And then apprenticeship helps to increase retention and stability. So while the national average for retention is about 93% across all industries with RAPs, ECE specific programs are seeing similar success, with 95% of educators reporting they now intend to stay in the field long term. Also helps to improve educator quality. Apprenticeships focus on building and demonstrating real classroom skills as teachers grow through mentoring and hands-on practice. One study tracked ECE apprentices over a 6-month period and found the measurable increase in classroom class scores across multiple areas as the apprentice teacher progressed through their apprenticeship competencies. And then the earn while you learn model helps to professionalize the workforce because it reduces financial barriers to entry in the profession by supporting a more diverse group of educators to work towards qualifications or a degree while maintaining a paycheck. Additionally, credentials received from apprenticeships are nationally recognized and often transfer to college credit and or help to map a clear career pathway and trajectory. And as we all know, workforce shortages in Colorado are often driven by low wages and high turnover. Apprenticeships can really help to bridge that gap by making the profession accessible and more sustainable. It's a practical skill-based model that lets teachers grow their careers while they're growing their paychecks without having to leave the classroom. And apprenticeships have grown rapidly in Colorado in recent years. There are now approximately 17 or so registered apprenticeship programs in our state, with many more in the development phase. And we're also beginning to understand the many benefits of apprenticeship to the ECE workforce ecosystem. So, for example, we know there are many benefits to mentors. They may experience an increased sense of value and recognition. They're developing skills in leadership, adult learning, and mentoring, and often receive a stipend or a wage increase where possible. And then for employers, there's lots of benefits as well. Of course, they're accessing a more skilled and knowledgeable workforce. They're improving retention and reducing recruiting costs, and a high return on investment, since apprenticeships really provide a high quality job preparation experience. And then for individuals, we've already shared a few of the many great benefits, but just to kind of recap, the earn while you learn model with built-in wage increases really is a recipe for success for many apprentices. There's a reduced or covered cost of tuition and other training expenses, and there's support for earning portable industry recognized credentials through mentorship and other types of support that are offered. And apprenticeships really lower barriers to entry into the profession, especially for underrepresented groups, and often even provide financial and wraparound supports while creating a pathway to to high quality careers and economic mobility. So what role has CDEC played in supporting apprenticeship? So CDEC has really made significant investments in supporting work-based learning pathways, such as apprenticeships. In 2021, received stimulus funding to support several ECE apprenticeships programs across Colorado. And thanks to our incredible partners and partnerships in our apprenticeship program, approximately 200 educators will complete an ECE apprenticeship thanks to this initiative. So as funding unfortunately winds down at the end of 2026, we are still very much committed to finding sustainable solutions to keeping apprenticeship as a viable workforce pathway. And we're really beginning to understand that apprenticeship is not only a powerful tool to recruit educators to the profession, but we're also seeing a lot of strong outcomes in our own state. So in a forthcoming report, the Colorado Evaluation and Action Lab found that over 3/4 of apprentices said that participation in workforce opportunities, including apprenticeships, has helped them get or keep a job. And 91% said that these opportunities help advance their ECE career. So the data is really clear. When we invest in teachers' development, we are directly investing in the stability of our entire ECE ecosystem. And so while these statistics are compelling, the real impact of the program is best described by the educators themselves. One ECE apprentice recently shared, participating in an apprenticeship program has significantly accelerated my professional growth by allowing me to gain hands-on experience while learning directly from experienced mentors in my field. It has strengthened my technical skills, boosted my confidence, and opened up valuable networking opportunities that have positively shaped my career trajectory. So we know that apprenticeships are a comprehensive and highly supportive approach for building and strengthening qualifications, and that this model can be replicated for other types of ECE professionals besides teachers, such as directors, home visitors, and early childhood mental health consultants. So what's next? To strengthen our commitment towards apprenticeships, CDEC has recently become a qualified apprenticeship intermediary, or QAI. So a qualified apprenticeship intermediary is a trusted partner in Colorado's registered apprenticeship system, recognized with a special designation from Apprenticeship Colorado. QAIs work alongside employers, program sponsors, and apprentices to make apprenticeship programs more accessible, effective, and sustainable. And in practice, QAIs bring partners together and provide a range of supports to help apprenticeship programs succeed, whether that's aligning training with workforce needs, connecting key partners, reducing administrative burden, offering guidance, resources, and capacity building support. QAI's role is to really help make it easier for high quality apprenticeship opportunities to expand and thrive. And so our vision at CDEC as a QAI is to serve as a statewide hub for ECE apprenticeships, strengthening the system through collaboration, shared models, and long-term sustainability. And we aim to do this in several ways. First, as a connector and convener. We hope to bring together sponsors, employers, mentors, and apprentices through strong networks and communities of practice. Next is advocation. I knew I was going to combine those two words. It's a new word, a new term. Education and advocacy. We really hope to increase awareness and understanding of ECE apprenticeships as a high quality workforce strategy. We also are working to develop models to create adaptable early childhood apprenticeship models and pathways that support diverse programs and encourage employer engagement. Next, we also aim to provide support and technical assistance. So by providing ongoing guidance, resources, and professional development to strengthen program implementation and mentorship. And then we also will continue to support with funding and resources where we can, And we hope to expand access to funding opportunities as well as shared resources with a focus on sustainability and underserved communities. And so really this is what it's all about, and what's possible when we align around a shared vision, bringing together partners, ideas, and resources to create something stronger than any one effort alone, right? Strong partnerships with early childhood councils and other key collaborators are central to this work, helping us stay grounded in community needs and expand impact across the state. And so if we want to continue to move this forward together, we have an opportunity to shape a system that truly works for educators, programs, and the communities they serve. So if you want to learn more about ECE apprenticeships, we hope that you will contact us and reach out and ask questions. We're also available to come and do a presentation for your council or your group. And we're really here to support you. So whatever questions you have, we'd love to have them or have you, email us and we can connect that way. And I know Charlie will be sharing these slides, so you'll have our information.
Kathleen, Stephanie Milner in the chat asked, are there specific examples of the national credentials that you were referencing? I wondered if you could speak to the national piece.
So the apprenticeship credentials are a nationally recognized credential that is specific to apprenticeship programs that apprentices receive. So, and it can be a combination through various types of training and or college coursework. So all of that culminates in a nationally recognized credential that is issued by the Department of Labor.
Claudia, go ahead.
So it sounds like September 26, your program is ending as far as the stimulus funding goes.
It'll be December. Mm-hmm.
Oh, is it December? Okay.
2026.
So how is it going to look moving after, after December? I know that you said that you guys are committed to continuing the program, but we all know that if there's no funding, it's very hard to continue. Do you foresee having any funding to help out with the apprenticeship, to help the sites with the apprenticeship, to help pay for this additional staff to come in and get them trained or et cetera?
Well, we hope so. We don't know yet ourselves what the state budget will look like. So we're waiting to hear about that as well. However, as a qualified apprenticeship intermediary, we may also be able to have access to different types of funding opportunities where we can continue to support programs. And it's another reason that we have our liaison relationship with CDLE, with Kendall, because Kendall and her team are very well connected to workforce centers and other types of workforce related funding. And there's developments every day in the funding world, right? So we're continuing to monitor what might become available. We're communicating those opportunities out whenever we can. And, we are committed to look for the funding that we need, that we can continue to support programs or to pass along opportunities for programs. Sometimes it's programs themselves that would benefit directly from applying for those funding opportunities. So we're committed to doing as much as we possibly can.
Kathleen, thank you so much for that. I'll add on that too.
Please, yes.
Another non-traditional, and sorry, my camera has been stalling all day, so I'm going to stay off for a second. But one of the other non-traditional funding streams that is available, it's kind of on an odd basis, but it is a tax credit for programs that have apprentices. Unfortunately, only for-profit organizations can apply for it just due to some of the ways that like Tabor reform or Tabor rules are applied, that they can't issue this one specifically to any nonprofit organizations or to school districts. But if we have independent childcare organizations that are for profit and are hosting an apprentice, they can actually register during the year and know ahead of time if they are going to be able to get that when they file their business taxes. And then when they file, I think it's $10,000 per apprentice, or is it
It's up to
12,000?
12.
There's a number.
12,000.
12,000, okay.
Mhm.
I know what the number 10 is. It's 12,000 for up to 10 apprentices. So I think the max amount that they could possibly get is $120,000. I don't know that there's any childcare program who would be able to manage that many apprentices all at once, but I hope we get to a point in the future where that would be possible / feasible. So there's a few ways that we're looking at this of like, what are both the upfront investment opportunities as well as taking advantage of the breadth of funding available in unique ways. So these are some of like the fact sheets and other types of resources that we hope to put together to support programming in the future. And I'll grab the link to that specific tax credit in just a second in case you're curious.
Thanks, Angela. That was a great point. Well, I think that we are over our time, so I encourage you to please reach out to us if you continue to have questions. Like I said, we'll be happy to meet with you or chat with you or your counsel. So thank you so much for your time, and we hope to connect with you soon.
Thank you, Kathleen. Yeah, this is, say, the best way to learn is to teach. I think this is kind of falls into that bucket, and really exciting opportunity for our programs here. So awesome. Danielle, you ready to rock?
Yes,
Cool.
I am. Hello, everyone. My name is Danielle Santiago Bourbon. For those who do not know me, I work over in on Kim. So a lot of times you'll see me over there. I just have a few updates and then just kind of an ask for everyone. Elaine Mascus, our PDIS manager, and myself, we have wrapped up our QRAS surveys, have gathered some great information from our different users of our system. And our ask is that you also share out a survey that we have put together. I'm going to put a link to the survey. We would like to hear from as many people as possible throughout the state, different programs, different setups, if they would share their insight. No feelings will be hurt. Just, give us feedback on the system, not our policies, just the system in whole. If you would not mind sharing out that survey to the whole world, share it out. So that's my ask. And then I will jump into a couple of enhancements we had released over the weekend, unless you have questions about that survey. I will pause for just a moment. Okay.
Danielle, this is Julia. Do you want this to go to all providers, or is this specific to council staff?
That's a great question, Julia. Yes, if you could send this out to providers, we would like the feedback from providers. If you have any council feedback, we were not able to capture any surveys or interviews with council users. We are still open to that. But yes, please share the survey with providers.
Sorry, I have one more question. I see that it's asking for responses to be submitted by March 31st.
Yes, we are. I should have checked on that date. We got our interviews completed a little late, so we'll push that back. I will update that date, but if the sooner the better. But if we could get that out by the end of this month, if we could get those responses by the end of the month, that would be great.
We'll try.
March just kind of flew by. All right. Okay, our first update that I am sharing my screen. Let me know when you can see it. I will try to zoom in to you just because this has a lot of. We have updated the back ordering naming convention to include when a spending request is back ordered, you know that a new spending record is created. Now we have a naming convention on there. It will have back ordered at the end, appended at the end of the name. So we'll have the back order, if you can see here, it has the original name of the spending request, then it has back ordered, and then it will go numbered from there. So if you back order multiple items, you'll know which ones are being back ordered and then the order they're in. So I was pretty excited about that. We did have an error with it. I know some of you experienced when you would back order an item, it would cancel, reject it. Super fun bug. We have that fixed into wherever you have back ordered the status of that spending request, it will go into that. So if it's approved, it will go into approved status on that back order. There's no need to take it out of back order. When you receive that item and you're ready to invoice it, you can just mark that, prepare it and mark it as for ready for billing. Any questions on that one? Awesome, awesome. So you'll see that was released over the weekend. So if you start back ordering now, you'll see those. If you have previously back ordered items, you will not see it on there, but you will see it on new spendings. Okay. I will jump to our next enhancement unless there are questions on this enhancement. Awesome. Okay. Our next enhancement is to further strengthen our fiscal integrity. We have updated the KIM system to require a more formal confirmation of receipt of all materials and services. This does not include coaching. By ensuring our programs and councils have verified they have been delivered before the invoice is even processed, we've added a layer of transparency that protects our budget and also ensures that we only pay for what we've actually received. So that was the why behind this one. So when a program has submitted either training or a dollar spending request and you have approved it. So this part now it's waiting grant lead approval. So it is not approved. This is the back end of that spending request. And here is the front end of the spending request. Can see that we have grayed out received here. And once the grant lead goes in for that second approval process and approves the spending request, we'll jump into here, refresh the screen. We will have a blue received button. So the program, once the program has those materials in hand or that services have been received, a training, professional development has been received, they will mark as received. I don't remember which one it was, so I'm going to do both. They received both of them on the front end. And on the back end, when you have that spending request and you are preparing it, which you do for every spending request, when you are preparing it by putting in the invoice number and the invoice date, you're going to look and make sure that the program has received, that has confirmed they have received the products. You do so by looking at this check mark. So this is a bigger learning curve for our programs. I have created a how-to guide. I'll put the link in here. It is in our QI module chatter files for them how to mark that they have received items. If you have back ordered an item and they've received everything else, there's no worries. They can mark that they received it. That back order is now on a different spending record. So once you have confirmed, you've put in the invoice date, you've put in the invoice number like usual. I'll finish this up, Claudia, and then I'll answer your question or take any other questions as well. And then you will click the edit icon, mark it as received. And the invoice will pretend the invoice number, invoice date is in there, and that mark for ready for billing button is there now. You can mark it as ready for billing. You've confirmed materials are there and you can move on. Anyone can do this once it's out over the approval flow. The QI navigator has approved it. The grant lead has approved it. And so at that point it is out of the approval flow. And then whoever in your council prepares spendings to be marked as ready for billing and do the reconciliation process, they have the permission set. They'll be able to put in the invoice number, put in the invoice date, and then also confirm that these materials have been received. I will stop sharing. And I believe Claudia's hand was up first.
So I have a question about what you were just talking about. So I ran in that today and I was like, what is happening? Because I went in and I put the invoice number and the date. I don't write anything until I have the statement or the invoice that, from the people, which means that it was shipped. So does Pam or do I, and where do you do that, go in and mark it as received? Because that must have been my issue today because I couldn't get it to go to ready for billing like it normally would have. And so can you show me again where you go to mark that as received? And I think you said that it doesn't matter if it's Pam or I, either one of us can do it. It's not restricted.
Yep, it is not restricted. You are correct. And yes, you will mark it here on the back end. So it's going to be where you normally put in that invoice number and that invoice date. It's going to be on that same page. The program is going to have to log in and confirm they've received it on their end.
Oh.
Yes. And then you will mark it as council that has been received.
Okay.
If sometimes this is bypassing right now, depending on when that spending request was entered into the system. So if you do have it there and those buttons are not checked, that means it did not go into this flow. Please just do the same process you've been doing, confirm that they have their materials. But as far as the formal approval, if your mark as ready for billing button is not appearing, it is because it is now in this formal.
Okay. All right.
receipt.
That must have been what happened today then. All right.
Yeah,
Thank you.
and I will put the link in here to the files in the QI module that does have the guide for yourself, for the council, and then also for the user on how to confirm it. Did that answer your question?
It did. Thank you.
Awesome. You're welcome, Claudia. Does anyone else have questions? Yes, Mandy.
I have one. Is there a way for us to find out who has marked their items received without going into every spending record?
At this point, I did try to create a report that pulled into that. I was not able to do that today, but I am working with our developers to see if we do have a report we can build with that. If not, and in the meantime, just when you are preparing the spendings for reconciliation, when you're putting the invoice number and the invoice date as usual is when you would also check that it's been received.
Right. I'm just thinking I have about 30 of those that I have to keep going in and checking because I'm waiting because of the timing. So, what about, could it be added as a column on the view under spendings? Is that an easier way to do it?
I did look to see, was not on the column either to be able to pull into the report today, but that is my thinking, is to put it in as a column because the invoice date and the invoice number is also on the column. But for some reason, I don't know, because this is new, I was not able to pull it into a column.
Okay.
But that is what I'm working on.
Ideally, that's the best place to put it, but I was just curious.
Yeah, working on it, Mandy. Thank you.
Okay. Thank you.
Have some questions in here. Let me know if I miss any of them. IT sent a help desk, but we have providers getting an error there. Yesterday, we did find, or the day before, I feel like this week has gone so fast, is that we did find some programs were receiving an error. We were able to fix that, and they should not be receiving an error. If you do have a program that receives an error for any reason, please send that in. We'll have to troubleshoot that, but we did ensure that it is efficiently working for providers on the front end at this point. So just make sure it isn't a previous error, because I do know some were receiving that, and we did have that fixed. At this point, Clea's question is this something that we require retroactive action? There is not. If it's depending on when it was put in, when that spending request is put in, it will either go into this flow and you will not have that mark as ready for billing button until you have confirmed both boxes have been confirmed. If you have that mark as ready for billing button there, and those are not marked as confirmed, it is not into the formal process and you can move forward as usual. Yes, Heather.
Is this a step that's going to be required for all spending requests?
Yes, this will be for all materials, all dollars spent. It
So
will
even
only-
if you're doing a reimbursement for a training or a reimbursement for a curriculum, that's something you're still going to have to go back in and say you've received the material, even if it's not a material that's being shipped?
Yep, it's for all materials and all services. The only spending it is not on is on coaching.
Is that in the provider facing documents so they understand it's not just when they're getting shipped materials?
Yes, that is in
Okay.
there. Yeah. And then please, when you read it, I put in there. And if you think there's more clarity that is needed, that you feel like your providers would need, please, let me know. And I'm happy to add to that document. All right. I think Julia, your hand is up first.
I had a quick question about that. So I hear what you're saying about the flow. So if the orders that were put in previously and it didn't get caught up in the flow, is there a way that can be documented in the information so we have that on record? Because I would hate anything to come back and say, oh, it should have been this way. And
Yes. You're saying like as for you to capture it, if you notice it's not in the flow, and then you want to make sure you capture that you have confirmed it has been received.
yeah, I will capture it, but I also want to capture that CDEC will still recognize that as a purchase.
Yes, absolutely.
Okay. Thank you.
Yes, Michelle.
So going back to that error message that you said that some providers are getting when they're adding materials, does that work is that same on the E&E?
Yes, this has been released on E&E, and it has been corrected for user all around, so they should not receive that error when they're marking E&E materials as received as well.
Okay, so actually my question is submitting a request for reimbursement.
Oh, okay.
I emailed you. I
Yep.
emailed you and because I was helping a provider this morning submit for reimbursement and we kept getting an error. Contact your administrator.
Yes, I did receive your case and I am going to reply to you. I suspect that it is an attachment issue, but when I respond to you, we can talk back and forth through that one and help you get that one submitted.
Okay, thanks.
Yes, Tiffany.
Danielle, do we no longer have access to the provider's dashboard?
You should still have access, not to put anything in there, but to look at it. If you're not able to, Tiffany, we can meet and look over and make sure that we're just not missing that dashboard.
Okay,
On
I
your
would really
page, yeah.
appreciate it, especially while making these changes. It would be easy just to go in there and see, oh, you need to confirm your spending records. So thank you.
Yeah, no problem. And Karen's question is, did a notice go out to all providers receiving QI funding? No, at this point it didn't. If they are going through QI funding, we do assume they are working directly with you, and we're leaning on you to help get out that information, and you have access to the guide to provide for providers, and let us know if there's any other way we can help get this communication out to providers. It was a funky catch-all. The next question is the process only for orders that are approved after this change. Yes, all orders that are approved after will be into this flow. If one was going through there in a certain time, like the moon was aligned, it may not have got captured into this. We even found one that is E&E that was in the very old approval flow from December, so it even looked differently. So if you do have one and you're having a hard time figuring out if it is in the flow or not in the flow, you need support with it, please put in a help desk ticket and I'm happy to help you figure that out. We do understand that, again, putting a new enhancement in at the end of the spending year is always a challenging time to put it in. If we could control when we put them out, we would have put it out when the spending year was opening up, but we have so many different things and enhancements going on and different things that were going on with our funding stream that this was the timing that we had to put it through. So we appreciate your patience as we work through the challenges of adding in a new process within our spending. And again, I'm just put in a help desk ticket if you do need any support with it. I am here. But if I don't have any more questions, I will turn it over to Charlie.
Any other questions? Thank you all. I know change is tricky, but please know this is not us getting on anyone's case. This is us just trying to do our best to make sure that we are in compliance while we are under kind of a more intense scrutiny than we have been used to in years past. So we appreciate you all rolling with us. And if you have any questions, reach out to your QRS coordinator. All right. Bonnie is going to give a brief contract update.
All right. Hello, everyone. Let me share. I'm really loving these one slide presentations like last month. But first of all, I want to just pause for a second and celebrate the fact that budget allocations for next fiscal year and contract documents got sent out today, because there has been so much work that has gone into getting those out for you all. So thank you so much for your patience. Thank you so much for working with us. Obviously, the entire world is changing every day, but I was very, very happy to get that email out today. So big celebration there. With that email, so this year you only have to complete your budgets and vendor contact sheets. So I attached them earlier. If you have any questions about the templates, let me know. I am asking that you return those by close of business in 2 weeks from today. So April 9th is the day that they're due. And then we're going to submit them via the same smart sheet form as last year. It's updated for this fiscal year. So I've attached the link in the email, and it's also here in this slide if you need it. As a reminder, so we're going to have one statement of work. So you're not going to have to fill that out this contracting period. I want you guys to take a look. I'm requesting one more round of feedback on that. I apologize for the shortened timeline, but I'm asking that you return it by close of business April 3rd. So it gives you a little over a week to take a look at those and get that back to me. So I've added language, just a couple of things I want you guys to look at the beginning, highlighting that ECCs can in fact be your own fiscal agent. The way the legislation was like translated into the statement of work didn't make that super clear at the beginning. So I wanted to make sure that was in there. I also added language in several spots really specifying that the contract requirements herein is specific to CDEC funded programming. And not just CDEC funded programming, the ones within the contract with us. If you have other CDEC funded contracts, those contract managers and that contract language is going to be responsible for that basis of work. Let's see. Oh, another thing I want to highlight in the transmittal process, I want to make it super clear that that is specific to the contract itself. It has zero intent. It says it in there, but I just want to highlight zero intent at changing the statement of work in any way, shape, or form. It does not substitute a contract amendment if necessary. Really, I'm just highlighting what we already do. which is if something comes up and we need your feedback, we might send out a survey. If we're moving funding around in the GAE, like we often do year over year, I just want to make sure that we are calling out when those emails are super important, so you know to pay attention to those. Another thing I wanted to mention before I get to questions is that in the communications section regarding non-traditional communication, I once again made it very clear this is only for the programs in this contract. And really what that is meant to do is if there is something going on where media is involved or where you're going to be sending out like mass communication to your communities, we just want a heads up on that. There are so many things happening right now that it's important. If communication needs to be streamlined, we're streamlining communication. And I just, like, no one's done anything wrong. It's just kind of basic best practice in the event something occurs. I also put in there, if there's an emergency, let us know within a reasonable time frame, because you need to handle that emergency first. And then kind of finally, those administrative deliverables, the communication plan, the closeout plan, the business continuity plan, those are all really best practice. As Charlie was mentioning, our programs are under heightened scrutiny at all levels, from the federal level to the state level. We're just in a really tight spot right now. And so we want to make sure that everyone is protected in any way possible, because we know those audits are coming. We just don't know when. So once again, I'm happy to answer any questions about those things. I appreciate you guys providing me with that feedback before we get them finalized, and I will hand it off to all of you. Yeah, Tiffany.
So Bonnie, when looking at the budget, for the first time, we do have some funds in CCR&R. So, and then when I went to the contract renewals, it specifically asks, are you the CCR&R? Do I check yes now, recognizing that there's money in that line item? Okay. And
Yes.
just curious, I sent this message to Michelle as well. Since I'm a 2-county, I'm Teller and Park, is that CCR&R SOW for both counties?
Yes.
Okay.
Yeah.
Thank you for
So it's for
clarifying.
your entire council catchment area.
Okay.
Yeah, Sherry.
So half-baked ideas, right? And half-baked looking at these things that just came. But Bonnie, when I clicked on the contract renewal link, I went through that, and again, back to that question, yes, you're CCR&R. And then are you doing EQIT? And then on the renewal link, it just gave me the option to upload the EQ budget information. But I didn't see a place to upload the actual larger contract budget. And I may have just missed it, but it wasn't really clear just in that contract renewal link about the systems building and QI and everything else.
Okay, let me go back and take a look, and I'll make sure those are available so you can upload those documents as soon as possible.
Okay. And then second question is, there's been a lot of conversation about the scope of work you've been working so diligently on and all the information, but that was going to be very general going forward. And then where we're really going to look at our work is in our strategic plan for the council.
Yeah.
And is that something that also needs to be uploaded now in April? Or
no, we'll just ask for your updates on those as part of your annual deliverables. So August 15th is when we'll want the updates, but you submitted all of those for the RFA last year. So you don't have to do a new one every year. But one thing I do want to ask with those updates is that you really emphasize our CDEC programs this go around. I know you guys do so much wonderful work in your communities outside of that scope, but for the purpose of this contract, we really just want to hone in on what this contract is paying for. Does that make sense?
Yes, it does. Okay, thank you.
Yeah, go ahead, Heather.
I asked this in an email, but I didn't hear back, so I just thought I'd bring it up with a CCR&R line. We used to cover multiple counties. It looks like this covers just our council catchment area, which is a single county. Is that what I'm understanding? Even if there are counties that we used to cover that did not accept the CCR&R money?
So the budget for those councils is still included in your budget.
But if one of my counties that I used to cover says they do want the CCR&R money, and the other council said no, I'm unclear from the way the
budget document looks. Got you. Yeah. So in this incident, if one county, so if you're covering 4 counties, one county said, yes, I want to be the CCR&R, but the other 2 said, we want to stay with La Plata. You're covering those 3 counties or 3 council catchment areas now.
But why would I cover them? Why would I cover them still?
If
I didn't have the opportunity to opt out covering them, but I am covering them, but they were able to opt out. That doesn't really make sense. Like they were able to opt out doing the work, but I'm not able to opt out covering them.
I mean, I guess if you don't want to cover them, we can meet offline and we can have
I
that
wouldn't mind. Yeah, I mean,
conversation.
Okay, just because it's covering them isn't as much money as if they covered themselves. I mean, that's what I'm trying to figure out what that amount is for.
Got you. Yeah. So we had to create due to changes in the ECC landscape, we're going to have some new ECCs coming on. We wanted to create a meaningful minimum if councils wanted to take on that work. We've been hearing for the past few years now that there were some councils that hadn't been their own CCR&R that really wanted to be. So that's how that was kind of created. But if you're covering multiple councils, you're already well above that meaningful minimum. And so that's kind of how that was calculated, if that makes sense.
Well, I don't know how $8,000 is a meaningful minimum of anything, but yes, I do understand what you're talking about. It's not clear to me why that wasn't a part of I guess what I'm trying to figure out is, am I required to cover them if we're breaking up a service delivery area because they don't want to do the work, or is this? I was trying to get clarification from this outside of this, but no one responded. So I'm just trying to figure out now, because this is only 2 weeks and I need to know what the expectation is for this.
Yeah, absolutely. If you want, Heather, we can schedule a meeting with you and the other impacted councils and we can work on a solution that's going to be best for everyone.
Okay.
Not sure if it's my turn. But I just wanted to let you know in the budget template that you attached to the email, the fringe benefits column is protected and we cannot type in it.
Got you.
So
okay.
If you're needing us to type in there, it will need to be unprotected and reset.
Okay.
I recognize that you just covered this a second ago and I jumped on the call late, so please accept my apologies. Can you hear me?
Yes. Yeah.
Yes. Great. I'd love to go back to the communication line. Bonnie, I'm sure you know that it was me that pushed back on that line and feedback. The line that states that ECCs shall not engage in any non-routine communication with providers, et cetera, without prior written consent of the department. Can you provide a little more clarification on that?
Yeah, so I specified in the version that I just sent out that that's specific to our CDEC funded programs within the scope of this contract. Because I know you guys do a lot more than just our contract. And so if there's another program where you're engaging with the media or you're engaging with your community, feel free to do it. But if there's something regarding these programs, we ask that we're notified first, especially before there's media engagement or like community letters are being sent out.
That I think makes sense. Is there an intention at least to define non-routine communication? Because I think non-routine is very vague. And for us, a lot of everything that we do, I mean, we've been doing this for 28 years as an organization, it's all routine. And so just if I recognize it's a hard term to define, but I just think just to ensure that we're not running afoul of any contractual obligations that we agree to, I would want that to be at least more defined and ensure that the statement of work clarifies that that applies to only ECC
Which
funded
it does
work in that contract. Okay.
Yeah, it does now.
Thanks.
All right. Are there any other questions? No? All right. Well, thank you guys so much. Like I said, I'm going to double check on that Smartsheet form, make sure you can upload documents. I'm going to check on the fringe being locked on the budget template. And then we will get a meeting on the books, Heather, so we can go through your CCR and our stuff as well. Sound good? All right. Thank you guys so much.
Okay, are you ready for me, Charlie?
Yes.
Fabulous. I hope you're all enjoying our fancy new slide templates that we have for you today. Okay, hi, Alyssa Pappas, Stimulus Grants Program Manager, and today I'm just sharing a few planning ahead updates for E&E closeout. So overall, today I'm focusing on GAE invoices. If you have not emailed me back to finalize your GAE invoice that I sent in at the end of January, beginning of February, please do so as soon as possible. What I need from you is a verification of which approved budget numbers are correct based off of what I have from the Salesforce poll and your previous CDEC invoice template. And then also don't forget to fill in the pink section of the GAE invoice templates, which are rows 5 through 8 before you submit any of those to OnBase for processing. So I cannot approve any GAE invoices at this time that don't have verified numbers and don't have that section filled out. Additionally, making sure that these GAE invoices are really solid right now will help make sure that closeout for emerging and expanding goes as smoothly as possible. So provider MOUs all end September 30th, 2026. For invoicing within your ECC contracts, it says that invoices must be submitted within 30 days for timely invoicing. So following that, Friday, October 30th will be the deadline to submit GAE invoices to CDEC for the emerging and expanding program. This does not include your base invoices, but for GAE funds, those must be submitted by Friday, October 30th, 2026, so that we can work towards closing out Salesforce. And if you have any funds that you already know will need to be forfeited, that won't be able to be spent, please notify me via email, or you can use the transfer request form that is linked, as always, at the end of this slide deck. If you have any other questions about these deadlines, or if you want to talk more in person about, or not in person, but via Google about your GAE invoice templates, the next E&E office hours is coming up the first Wednesday of April from 10 to 10:50 a.m. The video call link is here, or you can always schedule an individual appointment with me. Just saw a question come up. Great question, Lisa. So if you email me with questions, I can pull your individual council Excel Google Sheet slide or page and share it directly with you so that you can see where the numbers are coming from. I cannot share the full Salesforce report that I have. And yes, Julia, I would be happy to send that meeting invite out to you. If anyone else needs the direct meeting invite for office hours, just send me an email, or you can send a quick chat here and I will add you to that invite. And then the last slide has the link for transfer requests. That is all that I have. Any other E&E questions? Go ahead, Julia.
Oh, thanks. I just have a couple questions. I have two providers that are really kind of dragging their heels because they're home providers and they want to kind of change up what they wanted to do. You know, it's been 18 months and they got approved or whatever. So does all of that still, I need to email you, like, because I know there used to be a form and
yes, so
I apologize just with the changeover in my email address. I want to make sure I have everything.
no problem. The transfer request form that was linked in the slide deck, and I'll get that linked in the agenda when I'm done presenting, is how you can submit for transfers within categories. So as a reminder for that, no new capital requests will be approved. Any additional capital funds to be transferred need to be for a previously approved capital request. So say like you had been approved for doors and the doors are now more expensive than they were when they were originally quoted 2 or 3 years ago, 18 months ago, you can apply with the transfer request for whatever that gap is.
Perfect. Thank you so much for that clarification.
You're welcome. Okay. All right. Thank you all. Reach out to me via email if you need anything.
All right. Thank you, Alyssa. Next up, we have Julio to give a brief interim rating update.
Wonderful. Thank you so much, Charlie. Appreciate that. And good afternoon and muy buenas tardes to everybody. I am Dr. Julio Alas. I am the Professional Learning and Design Unit Manager here within the Department of Early Childhood Workforce at CDEC, where we oversee the professional development opportunities that we provide, maintain, and facilitate for the early childhood workforce. I'm really excited today to be able to present you all with a brief update on what's been going on with the development of the Quality Rating and Improvement System interim rating process. And so I want to just preface this by saying that this is going to be a brief update just to keep you all in the loop of where we're at right now. And surely as you hear this information, you're likely going to have questions. Now, I am one of the many collaborators that are working to make sure that this redesign of the QRIS goes smoothly and that we're thinking through many pieces and all of the different folks that touch this work. So I'm going to ask that if folks have questions about any anything that we're sharing about today, please feel free to use the resources that I am popping into the chat. The one that I really want to call your attention to is the form that we've developed that will allow us to see what questions community members are having as it relates to this process, the QIS redesign, the many things that might be on your mind that we want to make sure we can give you a good, clear answer on. So do know, again, if you have questions, feel free to use that last link that I just popped here into the chat. And really quickly, I want to say that, you know, here at CDEC, we are doing our best to ensure that any deliverables we create, such as presentations like what you're seeing right now, are accessible. If you find that anything in this presentation is prohibiting you from accessing the information, please do let us know. On this slide, you see a lot of information of who you can reach out to so that we can make sure we are giving you accessible documents and resources. And again, to Alyssa's point, I will also attach this presentation in the agenda so that you all can interact with it independently and have the information we are sharing with you today at your fingertips. Now, I want to start off by sharing that the CDEC right now is implementing an interim quality rating and improvement system rating process during a 19-month transition to the refreshed quality improvement system. And this is going to be occurring from May 2026 all the way through January 2028. Now, on your screen, you're going to see a very simplified timeline kind of detailing these important steps. But from May 2026 through September 2026, we want to let folks know that the rating system will be closed for new level 3 through 5 applications. And during this pause, programs will maintain their current ratings and continue quality improvement work. As we get down and closer to September 2026, the rating portal is going to reopen for level 2 programs that are seeking a level 3 rating through a streamlined interim rating process that I'm going to touch on here in just a few moments. Now, with that said, I do want to talk a little bit about what this means for early childhood programs that are currently rated. So as you see on your screen, those that have a QRIS level 3 through 5 are going to maintain their current ratings. QRIS level 2 programs may remain at a level 2, or they might be able to pursue a provisional level 3 if they are wanting to go that route. QRIS level 1 programs can continue moving to that QRIS level 2 with the current process. And we also want to make sure that folks are aware that accreditation pathways to the QRIS levels 3 through 4 will remain available during this time. We also want to talk a little bit about how we're focusing on support and streamlining processes through this new interim process. And really what we want to let folks know now is that some of the things we're going to be focusing on are going to include more focus on technical assistance. So for example, the work that programs are doing to engage with coaches, consultants, and mentors, the type of professional development that their staff are taking and leaning into, as well as the quality improvement goals that they are developing for their programs. We're also wanting to make sure that documentation requirements are simplified and that verification can rely on existing systems that we have and data that we have where possible. In addition to that, we want to ensure that this strategy is maintaining program quality and stability while also reducing that administrative load, and make sure that we're prioritizing directing limited funds to the programs and services that directly benefit children and families, and setting up the QRIS for really long-term system enhancements. Now, this was, again, a very brief overview, and you all will have access to these slides just so that you can get this update and share it if you would like with folks that are interested. But I want to emphasize again that if you have any questions, please feel free to refer to our FAQs. Those are linked in the chat right now. Feel free to submit a question to the QRIS interim rating and QIS refresh question form, again, linked in the chat. And if you prefer, you could also reach out to the Colorado Shines Help Desk by calling the number that you see here on your screen and then selecting option 1, or by emailing us here at our QRIS inbox with the email address that you see here in on the screen and as well in the chat. And so that said, that's what we have for you all today. Know that more information as this continues to unfold will be coming to you here soon. But other than that, I want to just thank you for your time and taking the time to listen today, and we will make sure to address any questions that come through the form. And so Diane, I see you have a question here. If you could send that to us through the form, we will make sure to get a response there. That way we give you the best clear response possible. So thank you all again for your time today.
Alrighty. Yes, Diane, you can ask through the form, but short answer is we're working on it. Nothing is set in stone yet. We are currently developing it. So, all right, we have EQIT updates. I think we do.
We do. Yeah. Yay.
Before you move forward, I just have a quick question.
Sure.
So the QRIS and the GAE, I mean, we have to respond back to that in like 2 weeks. And I'm just kind of curious. I mean, are we going to be moving forward with the new rating system starting in July, or are we just going to continue on with what we've been doing and no rating system?
I'll chime in.
I think we kind of need to know that with the budget sitting here, that we need to start moving forward, you know, and do. I think we kind of need to know if July we're going to have a new rating system.
No, Claudia, we will not have a new rating system in July. What we will have starting in September are for programs wanting to go from a level 2 to a level 3 are going to have an opportunity to rate through this interim rating process, right? So that would be for the level 2 to the level 3. And then anybody else, if they are a level 3 through 5, as you saw in one of the slides there, will be able to keep that rating. They can decide to pursue an accreditation if they would like to move up to a 4, for example, if they're a 3, but there will not be an established process until January 2028. And so during this time, again, the process that we'll have in place will be for those wanting to move from that 2 to that 3, we'll be following what we're currently developing now.
Okay, thank you for the clarification.
Absolutely. And please, if there's more questions, feel free to add them to that form. We know that there's a lot of great things that are popping up for you as you're thinking about this. So please, Claudia, if you'd like to also have that question answered and added to the FAQ, that form is going to be your best bet there so that we can make sure we're answering thoughtfully and thoroughly.
All right, thank you. I did pull that up, but I just was kind of freaking out there for a minute, knowing that we have our budgets due in July. For July now.
Absolutely, totally valid, and we appreciate you raising that. Thank you for raising that with us. Appreciate you.
Riley, I think you're good to go.
All right. So, welcome everybody. I'm Leah Grossman. I am the EQ training specialist, and we have just a few updates today, but we wanted to make sure we got them in front of you just to keep things top of mind. So first up, we will be having our EQIT annual statewide meeting May 4th and 5th in Denver. Registration information will be coming very soon. We are waiting on a room block, and as soon as we have that, we will get things out to you. We are hoping early next week so that you can start making plans for your specialist to attend. I know many of you have been in communication with Eva about travel and how to make that work. I do know in another meeting I was in, Sarah Roberts told me that if you are finding you need support in getting folks to attend, she also has some funds available. So keep that in mind as you are thinking about supporting your specialists. Let's see. We are partnering up with ECLA and doing our first work session on Monday, April 6th to start nailing down some of that information that you shared with us when we were all together and getting to do our one-on-ones over the past 4 or 5 months. So we are excited to begin that work and to meet with you. If you have any questions, please feel free to contact Eva so that she can provide some guidance for you. We will also be at the Rocky Mountain Early Childhood Conference. Eva will be presenting with Brenda and Robin about the credit for prior learning process and how that is being rolled out in the PDIS. Dusty and I are also presenting on the 16th. I believe this one's the 17th. Dusty and I are presenting on the 16th. And we also will have a virtual session that will be available out there. So there are many ways to engage with EQIT and our EQ initiatives over the next month or so. We're excited to see you all. And for many of you, we're about halfway through. We've got half of our infant toddler specialist credentials renewed for this next year. They're fine if they're teaching right now in the spring, but when you start turning in your plans for next year, so next fiscal year, starting July 1, everybody needs to be credentialed for your plan to be approved. So please do remind your specialists that they need to go into the PDIS and select Infant Toddler Specialist Trainer Renewal and complete that process. Do make sure they submit. I think you have to press the button like 3 times. They want to make sure that you're really sure, but I'm happy to get them approved and ready to facilitate next year. So this is that reminder, and I think that's it. That's all the things. So any questions about anything we have for you today? Ooh, which one, Lisa? When you say, will this include, did I miss?
Well, I'm wondering if people who are administrating EQIT happening in our community, in some years we have a component that we should attend, and other years it might just really be for our infant toddler specialist. So I was just curious this year so I could plan ahead.
Gotcha. Okay. Right now we are planning specifically for the infant toddler specialists and their work in the curriculum and some other things that we have planned for them. Eva, were we thinking on adding anything specific as?
You know, we always encourage and extend welcoming to any administrators who would like to come. I think we're really kind of carving out some of the work group time to focus a little bit more on systems work in terms of policy and process for the initiative. However, we of course always love to see any of you all there, and you're all welcome to attend if you would like. And it is in Denver this year. So,
all right.
Yes.
Thank you.
Thanks, Lisa. The other Lisa.
Yes, we love to tag team each other. So I was out last week, so I'm just slowly catching up. I know you sent the EQ information out for this upcoming year and the new rates. As we think about planning for the next year, I assume there will be another EQIT meeting that we need to somehow plan for. And at this point, you're not sure where it is. So in terms of travel and accommodations, we just need to go with the flow until we get there.
Yeah, unfortunately, we're not that well organized to plan that far in advance for the next year's meeting. I know that many councils do set aside some funds. I also try to wiggle things around in the GAE to reserve travel funds to support you all. So, you know, knowing that maybe it would be in a different location in the state. So I think you can kind of bank on that for next year too. But yeah, I would suggest, you know, if you have set aside in years previous or this year for travel, I would suggest kind of going around the same ballpark. The only other thing I might add on that is Leah will be offering our Coaching with the Relate training next fiscal year. Most likely it will be, you know, kind of around this same time that Foundations course is running. So that may also be something for you to consider, especially if you have specialists who are going through Foundations right now, that they, you know, will be welcomed to join the EQ Coaching with the Relate training that will be next year. So you may want to set aside some additional travel support for those folks.
And you can certainly reach out to us with questions about that so that we make sure you have just what you need. All right, Charlie, I think that's it for us.
Cool. Sounds good. Eva, you have a friend here today.
Yes, this little one is not feeling well today.
Sorry to hear that. I remember when I started as CDC, I think this little guy was in your tummy.
Yeah, well, this is a little girl, but yes.
Oh,
little boy.
sorry.
Yeah. This is the older one. She's 6 now, but
Okay. Cool.
little guys too. Yeah. Yeah.
Cool. All righty. We are on to our last item here. I have been tasked with gathering some feedback from everybody. So if you don't mind joining me in this lucid chart, there are really just 4 questions that we have to answer that I've been asked to answer, and to get feedback from stakeholders on. So everyone see my lucid chart. As a reminder, you can add a post-it sticky note here. Pick whatever color you want. And I just have 4 questions on here. So the first one is, and does someone on my team out there, do you mind typing these questions into the chat? What can CDC and our programs do to robustly what did I do? What can CDC and our programs do to robustly engage many parents in co-creating solutions? That's the first question here. So please answer on sticky notes. Again, you can find them over here. Just add a sticky note. Here's a second question. What can CDC and our programs do to specifically support and engage fathers? What can CDC and our programs do to encourage more diversity among professionals in the field and the local community agencies that we partner with? And finally, what can CDC and our programs do to increase awareness among families, providers, professionals, and community as a whole about how to keep children safe when in care? So I guess, how do we increase awareness about how to keep children safe in care as a whole? So if you guys don't mind, let's just take like 5 or 10 minutes to check to answer some of these.
Harley,
And then
is this the only time that it's going to be available for us to do this?
no, you can jump on whenever you want. I'll keep this open until tomorrow, at the end of the day tomorrow. So yeah, if you want to hop, feel free to hop. I do ask for just like maybe one or two pieces of feedback here would be wonderful. But yes,
For some of this, I'd like to think about a little bit more than 10 minutes. So
yes, 100%. So yeah, feel free to think about it. This link will be available on the agenda, which is always linked in the invite. If you're able to jot some ideas down for the next 5 minutes, feel free. And then this is the last thing that we're doing today. So I think I'll just kind of hang on for about 10 more minutes until 2:40. If folks want to add some things here, and then I will be signing off at that point. But yes, this link will still be available. So feel free to stick around, fill this out, sign off if you need to. Happy to answer any questions that are out there. It looks like we have a couple. So I'll stay on. And yeah, we can bring this back to our next TA as well. Tiffany, do you have a question?
Charlotte, and I'm sorry, and I'm like Claudia, I might need to chew on this a little bit more, but isn't this what councils do? I mean, that's really our job as a council, is to do these 4 areas. And so by you supporting councils, you guys are supporting all of these different groups. So I guess I'm just very confused on what you're asking for, because we are already doing that.
Yes, Rebecca.
Yeah, I'll jump in and take that. And Tiffany, it's a great point. I think that the goal here was Dr. Roy asked us to kind of engage in some of these questions over the next few months as she puts together her budget priorities for next year. So I think that your comment is a really important one. And I hope that some of that sentiment could get shared with leadership so that they also hear the critical role that councils play. So, but that is the purpose of this. It's really to help Dr. Roy prioritize for next year.
Also, maybe thinking of it in terms of, you know, these are what we want to accomplish. Maybe if there are like barriers or things like that that are preventing you as a council from accomplishing these goals as effectively as you'd like to, you know, thinking of it in terms of that, like what else could the CDEC do for you to help accomplish these goals together? Cool. So like I said, I'll hang on until 2:40. If you have to hop, feel free to hop. Thank you all so much for participating today. I know there's a ton going on. Please reach out with any questions about contracts or anything like that. And thank you all so much for the work that you do and for bearing with us as, you know, we're going through this continuous change throughout this year to continue into the future. And we really just appreciate you all so much. So thank you.
Hey, Charlie, why I have you on the call. I have not had a chance to look at that GAE reimbursement for February again. Do you have some time to talk to me about that, or do you still want me to submit a ticket? I just have that one that it was paid, but it was showing up as unpaid and I couldn't reconcile it.
Yeah, if you please submit a ticket with the link to exactly which spending record it was. And then if we still have questions, we can set up a meeting.
Okay, sounds good.
Cool.
Thank you.
Thanks. I'm going to stop the recording, but I'll still be here to hang out.